This time on Established on Campus, we hung out with Daniel Yu, the founder of Reliefwatch, to learn how his company is changing the status quo of how medication is tracked in the developing world. Hey guys, welcome back to the Established on Campus dorm room. Today we're joined by Daniel Yu. He's the founder of Reliefwatch. Can you tell us a little bit about your product?
Absolutely. So Reliefwatch is a platform for health organizations in the developing world to track essential supplies through basic mobile phones.
How did you guys come up with this idea originally?
Yeah, so it actually comes out of my personal experience. So I lived in rural Egypt for a period of time, and while I was there, I happened to go into the local health clinic in this very small town. And I saw all of these stocked out and expired medications and realized that they didn't have an information system in place keeping track of what they had. And that was a result of not having computer or internet access. What I realized they did have, though, was mobile phones. And in fact, more people in the developing world now have a mobile phone than access to running water. So it's an amazing tool that's become ubiquitous as just part of everyday living. And I realized that we could actually use the mobile phone as a way to keep track of what the clinics have to help them prevent these stockouts and expirations.
Okay, wow. And like you said, using mobile phones, that makes everything so much more easy and efficient. Mm-hmm. Can you talk about how, how it works? If I'm a first-time user, it's my first time using it.
Absolutely. So imagining that you're a health clinic worker who runs a clinic, let's say in rural Honduras, you get a call on your phone. It's pre-scheduled routine, so let's say 5 p.m. every day. And the call comes in, and it literally goes through your product levels in an automated form. So it'll ask how many bottles of ibuprofen you have, how many bottles of acetaminophen you have. And you respond to that just via the keys and the number of pads. So you just punch in 42, 57, whatever. Then immediately all of that data gets updated in a cloud system that can be accessed from anywhere, hundreds of thousands of miles away by the warehouse manager. So they can log on and see what does your clinic have, what you need, and make sure you get resupplied with those items before you run out of them.
Okay. Wow, that's awesome. And as you said, this was from your own personal experience. You had gone on a trip and you realized that this was a problem. But, in terms of the market and what's out there now, can you talk about, is there anything else out there, and what is your main competitive advantage?
Sure. So, when we look at the existing competition or really what have these clinics been doing before, it's really just the status quo of inventory management as it's been done for hundreds of years, which is paper and pencil. And obviously that has huge limitations, right? The paper doesn't travel, it just sits in the clinic. Once the pharmacist or the clinic worker writes down what they have, that information doesn't get transferred to the people who need to know about it. So really, we're coming in and disrupting this entire ecosystem of clinics, systems, health organizations in the developing world that really have been left behind by a lot of the technological innovation that's proliferated in the startup scene.
What is it like to be established on campus, and what are some of the benefits of starting in college?
Yeah, I think there's no better place to get started, to get feedback on your ideas, to have access to such a multitude of people than on a college campus. To me, I see universities as being the highest density of diverse, talented, capable people on the planet. The environment that you're in, where you're literally just blocks away from tens of thousands of people who are world experts in their field who you can just reach out to and talk to, and usually they'll help you, no questions asked. That's amazing. And so for us, just getting started, it was immeasurable the support that the University of Chicago gave me. We were able to benefit from space. They gave us free offices to work out of, mentors, advisors, and now actually investors. So to kind of see the progression of us from just being really an idea that we were talking about in a dorm room to now an actual company that has employees and customers. It's really amazing.
And if people want to learn more about Reliefwatch, where can they go?
Absolutely. You can go to our website, www.reliefwatch.com, as well as feel free to send me an email too. My email is just daniel@reliefwatch.com.
What did you think of Reliefwatch? Tweet the founder, Daniel Yu, or let us know at EST on Campus. Don't forget to subscribe to our channel for updates on student startups or check out our website at establishedoncampus.com.